What's up, guys? It's your favorite host, Peyton Weston here, broadcasting live from Galva, Illinois. And just because coronavirus is making us all turn to social distancing, doesn't mean that we still can't give you guys a show and give you guys some great content. And we have a good show for you today. Today's topic is the endocrine system, and we're actually going to be talking with two experts in the field of study, and we will be discussing more in depth about the pineal gland and the pancreas. So just remember that you can chime into our show at any time using our chat feature on our website. So now, before we tune in with our experts, I thought I would share some information with you about the function of the endocrine system, as well as its importance to the human body. So the endocrine system is responsible for regulating various body functions through the release of hormones. Hormones are produced and secreted by the glands, and they have many functions, such as regulating metabolism, growth and development, tissue function, sexual function, reproduction, sleep, and other various jobs throughout the body. So our first expert today goes by the name Claire Johnson, and she's a really good friend of mine, and she's going to be talking with us about the pancreas.
Thank you, P. Weston. Thank you for having me on your show today to talk about the pancreas. So first, we're going to go ahead and start with the function of the pancreas, as you previously stated. So it not only functions as an exocrine gland, but also an endocrine gland as well. As an exocrine gland, it secretes enzymes that break down proteins, lipids, carbohydrates, and nucleic acids that are in the foods that we consume. As an endocrine gland, it secretes insulin and glucagon to control the blood sugar levels throughout the day in our body. Next, as far as hormones go, the pancreas is responsible for releasing insulin, glucagon, and somatostatin. There are a few more that the pancreas also secretes, but those are the main ones that I'm going to be talking about. So, insulin regulates blood glucose by allowing the body cells to absorb glucose from the blood. And then glucagon stimulates the body cells to release glucose into the blood. So glucagon is the opposite of insulin. Basically, they just oppose each other. That's kind of the easiest way to think about it. And then finally, somatostatin inhibits secretion of insulin and glucagon, so it's secreted by the delta cells. So without somatostatin, glucagon and insulin would not be secreted from the body.
And so, Claire, we actually have some questions from our viewers. They want to know where exactly the pancreas is located, and what are some diseases associated with the pancreas?
It is located behind the stomach. The head of the pancreas is on the right side of the abdomen. It's connected to the part of the stomach that we all know as the duodenum. Well, for a couple diseases of the pancreas, the main ones that we're going to focus on are diabetes and pancreatitis, since those are the two most common diseases of this gland. So we're going to start with diabetes, which I'm sure we have all heard of, and I'm sure that we have loved ones close to us who have some form of diabetes or have had diabetes of some form. So the first one is type 1, and this used to be called juvenile diabetes, as it used to only occur in the younger population. However, we are finding more and more people being diagnosed with type 1 nowadays as well, who are of the older generation. So type 1 is when the beta cells of the pancreas are no longer making insulin because the body's immune system has attacked them. So type 1 is an autoimmune disorder. Type 2 diabetes, on the other hand, we can remember this by type 2, the problem is you. So usually this is when more lifestyle changes are factors into the person that has developed type 2 diabetes. So in type 2 specifically, the pancreas loses the ability to secrete enough insulin in response to the meals. So we're not getting enough insulin to combat the food and the consumption that has just occurred in our bodies. Now for pancreatitis. Pancreatitis is exactly what it sounds like. Itis meaning inflammation, so this is inflammation of the pancreas. This occurs when digestive enzymes become activated while they are still in the pancreas, causing irritation of the pancreatic cells. So in a normal situation, digestive enzymes would become activated after they have left the pancreas, but in pancreatitis, they are being activated in there, which is causing a lot of irritation to the inside of the pancreas walls. So there's a couple different forms of pancreatitis. I'm going to go ahead and explain acute pancreatitis, chronic pancreatitis, and hereditary pancreatitis to you as well. So we'll start with acute pancreatitis. This is the most common situation of pancreatitis that a person could experience. So the most common cause of acute pancreatitis are gallstones, as well as chronic alcohol consumption, hereditary conditions, trauma, medications, infections, abnormalities of the electrolytes in our bodies, as well as high lipid levels and hormonal abnormalities. Next, for chronic pancreatitis, the most common cause is chronic alcohol consumption. Others include cystic fibrosis and other hereditary disorders. For most patients, there is no known cause, though. If the pancreas becomes destroyed in the later stages of the disease, patients may develop diabetes mellitus as well. So you can kind of see how pancreatitis and diabetes both go hand in hand. And then finally, for hereditary pancreatitis, this is an inherited abnormality of the pancreas or intestine. So this will often run in families because it is inherited. The most common cause of this is cystic fibrosis, and this is a progressive disease with a high risk of permanent problems. Also, because I just love the pancreas so much, I have a little fun fact for all you viewers that may be listening from home that you may not know. So the pancreas gland is considered a shock absorber, and this was depicted by early scientists and researchers. The idea from this came about because the gland has a rubbery texture, as I'm sure we can remember from many situations of seeing a photo of a pancreas, or maybe some of us have seen a pancreas of a cadaver, but it's kind of that rubbery chewed gum texture, some may call it. So because of its rubbery texture and the location of it in the body, the researchers also believed that the pancreas was responsible for protecting the stomach from getting damaged if a collision with the vertebral column occurred. So that's why it was known as a shock absorber. So just a little 6-inch organ that we have can do so much to prevent us from having detrimental injuries.
Well, thank you so much, Claire, for taking time out of your day to come on my show and talk about the pancreas. We really appreciate it. Now, our next speaker is another close friend of mine. Her name is Anna Scholl, and she will be talking with us about the pineal gland.
Thank you for having me on the show, P. West. It's a pleasure to be here. So I'm here to talk about the pineal gland, and this gland is one of my favorite glands because it regulates sleep, and who doesn't love to sleep? And so anyways, this gland is located behind the third cerebral ventricle in the midline of the brain. It's this little pine cone shaped gland, and pine cone is actually where it gets its name pineal gland because in Latin, pinea means pine cone, and the pineal gland is shaped like a pine cone. So that's a little tidbit of information. But basically, this gland functions to regulate the body's circadian rhythm or sleep-wake cycle, as I mentioned earlier, and it also plays a role in regulating the menstrual cycle, pituitary gland functions, conversion of nervous system signals into endocrine signals, immune functions, and it also acts as an antioxidant.
And Anna, one of our viewers actually want to know about the hormones that the pineal gland secretes, and they want to know which ones get secreted and what exactly those hormones do.
So, good question. Melatonin is the hormone that is secreted by the pineal gland, and some of you may have heard of this hormone because some people take melatonin supplements to help them sleep at night, and the reason for this is that it helps regulate the circadian rhythm. However, natural secretion of melatonin is regulated by light. So the more light that you are exposed to, the less melatonin that is secreted. So that's why you should sleep in the dark at night and not look at your phone before you go to bed, because the light from your phone can inhibit melatonin from being secreted by the pineal gland. So there are some diseases and disorders of the pineal gland, one of which is a tumor. And, well, this is not good because the pineal gland interacts heavily with blood and other fluids due to its location in the cerebral spinal fluid. So many other bodily processes may become affected due to this tumor. And early symptoms of a tumor include seizures, disruption in memory, headaches, nausea, damage in vision, and other senses. So this is not good. And some other things that can happen with the pineal gland is dysfunction due to decreased melatonin secretion. So decreased melatonin secretion can cause sleep pattern disruption, such as jet lag or insomnia. And some other effects of this decreased melatonin could be abnormal thyroid function, anxiety, intestinal hyperactivity, menopause. low blood pressure, seasonal affective disorder, and abnormal adrenal function. Other information that I didn't include earlier is that low melatonin levels in children could lead to an inadequate amount of growth hormone, therefore negatively impacting the child's growth and function. P. West, thank you so much for having me on the show. It was a pleasure talking about all the good things about the pineal gland. Bye.
All right, thank you, Anna. It was a pleasure to have you on the show. And just to let you guys know that the pictures that both Anna and Claire shared with us will be on our website if you guys want to take a more in-depth look at that. So now, as part of our show, we will be asking one lucky caller some questions that they learned today. And if they answer all of these questions correctly, they win a prize. Grandma Barb, tell them what they could win.
Hi, Pay. If everybody answers these questions right, our first prize will be the Sherman roll. Everybody needs this, you know. And second prize, and if they answer all these questions right, paper towels. Paper towels goes along with Purell. So there you go. Answer all these questions right, and there you go, folks. Grand, beautiful prizes.
All right, caller, what's your name and where are you from?
Hi, my name is Julia Hanasek, and I'm from Big Rock, Illinois.
All right, Julia. Well, we wish you the best of luck today. Our first question is, the pineal gland releases which hormone?
A, melatonin.
That is correct. The second question is, the pancreas releases which of the following hormones?
B, insulin.
2 for 2. Can you make it 3? Which type of diabetes can be managed by lifestyle changes such as diet and exercise?
That would be type 2 diabetes.
All right, this one is for the grand prize. A patient presents into the neuro unit with a tumor of the pineal gland. The nurse would suspect the patient to present with which symptoms?
I'm going to go with seizures, nausea, and memory loss.
Congratulations, Julia. You'll be getting your prizes in the mail shortly. And now, before we end today, I just wanted to remind you all to keep washing your hands and practicing social distancing. Together, we can beat this virus and flatten the curve. However, on my show, I like to spread positivity and happiness. So today, we're going to be giving you a preview of the new hit song brought to you by the Pancreas Pals called The Student Nurses of Healthcare.
So this is a story all about how our lives got flipped and turned upside down, and I'd like to take a minute, just sit right there, and tell you how we became good student nurses in healthcare. At St. Ambrose, nursing students were praised. At the Health Science Building is where we spent most of our days. Farm, mental health, process, and theory were cool. We were just trying to pass level 2.
And there were a few things that we misunderstood. We started to ask questions like we know we should. We WebEx with our professor, and she was right there. She said, let's learn about the pancreas and how it impacts patient care. The pancreas secretes insulin day after day. It also works in many, many ways. A proper blood glucose range is the only ticket, so grab a patient's finger and might as well prick it.
Insulin resistance. Yo, that's bad. It's more likely to happen with a higher body mass? Is this what the people with diabetes are living like? Yeah, but which type? I was type 2 and we learned this year that type 1 was autoimmune and information was becoming so clear. In the US, diabetes is not rare, so we thought we should learn about it for client-centered care. We learned type 2 can be managed by exercise and what they ate, and type 1 requires something a little greater. I gathered my information. I was finally prepared to sit on my throne as a student nurse in healthcare.